I hope not.
I won't
So
be here, man.
yeah. So it's we should be live. I hope it's working.
It says live on my screen.
Yeah, mine too. So I guess you should introduce yourself, right?
You're the host.
Well, I've never done this. Well, everybody, like I promised, we're gonna do a Q&A with Dr. Susie. I've been doing her DIY pelvic therapy video series, which is awesome. It's really great so far. I think I have 1 or 2 more weeks to go. So, with further ado, Dr. Susie, do you want to introduce yourself? I got to bring up those questions.
Yeah, hey guys, it's me, Dr. Susie G. Thanks, Michael. That was awesome. I'm glad to be here. And I think this is a great opportunity to share a lot of knowledge and debunk some of the myths around,
Yes.
pelvic pain that are out there. So thanks so much for this wonderful opportunity and for your idea. It was all Michael's idea. So this is really great.
Yeah, it's not. I don't know why. I gave it a shot to do it, and you accepted. So thank you. Because
Yeah, anything to help, honestly. Anything to help, because the more knowledge that's out there, the better people will feel.
Well, first of all, before we even get started, I think what you should do is tell people how they can get in contact with you. Right now, it's 11:05 p.m. in Japan. What time is it there?
So I'm in Asheville, and it's 9 a.m. here.
Wow, 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 wow. How can they get in contact with you?
So you found me on my website and my book. I'm actually working on the second edition of that book because there's so much more to know, to tell people about.
Well, I think you should introduce yourself, because why would they contact you, right?
Yeah. So I thought we did the introductions already.
No, you got to do it like how you would want to be introduced.
Well, this is how it is. I'm Dr. Susie G. Gronsky. You can find me on my website, drsusieg.com, and all the information that you want to know about me is on there. I hold nothing back. I also have an Instagram page at Dr. Susie G and Twitter at Dr. Susie G and Facebook. So that's how you can contact me. And through my website, of course, I have a email thing on there as well.
And you're a pelvic pain specialist, right?
Yes. So I'm a board certified pelvic health rehab specialist. And there is unfortunately no certification specific for men. There's a certification specific for women, but nothing for men. And I'm hoping to change that. I'm actually teaching for my board, the American Physical Therapy Association. I'm the first to teach or bring on board a male curriculum or male specific curriculum to that program. So I'm hoping that might change. Although there's a lot of crossover between, women and men, because the treatments might be similar in that, but very individualized, of course. So we'll see where it goes in the future.
I hope so, because actually, I know a few nurses here in Japan and in America. And when I try to explain to them, like, I have pelvic pain, they always say, "Isn't that for women?"
Oh, yeah. No, not just for women. Guys have pelvic muscles too.
I know. Well, let's get started on these questions. So I asked a few, and I asked on my last video, and I got a few responses. And for the guys who are watching, what I tried to do is I try to do it less specific, more of a grander, general question. So I took the questions and made them a little more generalized, because I feel like this way it can help a lot more people, because when it's really specific, it's like I'm trying to remember exactly what it was, but people would ask me these super it hurts in this exact spot, what does that mean? It's like, that doesn't really help. If a more generalized question would help so many people. So if I change your question around, I apologize, and hopefully if this goes well, Dr. Susie will come back and do a few more in a month or so.
As long as we have some fun. You gotta promise that we're gonna have
100%, 100%.
Can't be dry.
Yeah, it's actually,
I don't roll like that.
Yeah, you know what's really one of the things I really love about your book? It was like talking to a dude. I hate to say that. I was like, oh, it's like talking, because usually, like, especially some doctors, especially in Japan, it's I got a new I got a new iWatch and it talks when it I had the Apple Watch and it's like freaking me out. No, but I especially like that because it's like talking to a dude, and even when you talk about your your private parts, it's always weird saying it to the doctor. And reading the book is like, okay, all right, I can talk to this person, I can like be myself. And that's one of the things when I first read it, I was like, I had to double check. I was like, isn't this a woman writing this book? Why is it written like that?
Well, and my inspiration was you guys, right? Like it was, asking my patients about, well, what would you guys like to have, or what would have helped you before going down this journey that you've embarked on. And everyone across the board was like, I just want somebody to tell me what's going on, what I can do for it, like a dude's manual. And I said, I can do that because that's how I think. I mean, I love keeping things simple. I love being down to earth and having fun with people and being human. I mean, we're all human. And so I'm not any better than anyone else. I just know a little bit more about this area, just like you know about what you do and being a teacher and apparently Google Hangouts and all of that. So
I hope this shit's working. That's
if not, it's somewhere in the ethernet, but I trust you, right? So that's it. I mean, it's just being human together in this world. We're full of struggles and we're trying to make life a little bit easier. And that's kind of what my message is, honestly.
It definitely is. I have headache in the pelvis. I first got, when I first got it, I'll say a backstory. My girlfriend and I've been struggling with this for like, I guess 3 years now. I can't remember, but we first heard it was prostatitis and we couldn't do anything about it. It was a really dark time in my life. And then the doctors couldn't really help us here in Japan. And then my girlfriend said, no, I don't think it's prostatitis. I think it's pelvic pain. So I Googled, and the first thing that came up is this talk. I've linked it in my other videos. It's a talk about what people are supposed to do at the doctors when you go in with this. And the doctors weren't doing any of that in Japan. And then I went to headache in the pelvis. And then I can't remember the guy's name. His name is George. Recently, he was like, oh, you should do this DIY program. And that's why I found you. But the difference between headache in the pelvis and you was headache in the pelvis was more like, if you want to go deep and scientifically, and he really gives you all that stuff. And it's great to hear.
It's a great book. Yeah, it's a great book.
And the first versions you can finish in a sitting if you're really focused, right? But your stuff is really straight to the point. Like you can finish it in an hour and two, and it's just quick information. Like this is exactly what I need. I always tell people buy both of them because you teach them what to do, and then when they want more information, they can definitely hit the other. And that's why I was like, oh, I need to contact this lady. Let me see if I can at least.
Well, I'm so glad you did. Yeah, I'm so glad you did. You're cool, and I love it. I feel really comfortable talking with you. So.
Same here.
And the cause is all for the greater good.
It is, man. It is. People like I was telling you before. People message me all the time, and I try to answer as much as possible and as positive as possible. And sometimes I get frustrated too because people leave like these comments, and I'm just like, oh my god, like. It's tearing me apart. Some of them are, no one's really left negative comments, only like one or two that I've seen. Everybody's pretty positive, but I'm glad that you mentioned debunking stuff because people post stuff. I'm like, that is not legit. Doctors don't want to steal your money. Like they want to help you. Like they're not going to do certain things. And certain people in certain countries, they're doing stuff that is just like, it doesn't make any sense.
Right. No, I hear you. And I can totally feel the frustration that someone could have. Because I mean, I've been down that route. I mean, I don't have a penis or testicles, but I've got the male homologue to that, which is an ovary and a clitoris. But at the same token, needless to say, the journey was quite the same of going through a lot of doctors and spending a lot of money until I got into touch with someone who really knew what they were doing and can help me and deliver the right message at the right time. And
that's another thing that you actually had it yourself, right?
Yeah, I did. And it's still, again, for me, it comes and goes, but I now know what I need to be doing. If my lifestyle changes to reflect that, then it makes sense for me, right, in my world and what's going on. So,
and I think that's the thing that you always talk about is the self-empowerment. Once you know, like, shit, I got it. all right, this is what I need to do. I need to get home. Let me knock this out. Like,
Mhm.
it's more like a pimple on, I don't want to say like a pimple on your face, but that's probably what it is. It's kind of like, oh, I got that. Like, even now, like I would admit, the whole day I was pretty good, and then for some reason an hour ago I just had the pee feeling, and I'm just like, oh, here we go again. All right, let me just relax. Let me do my breathing. I'm holding
Yeah.
in my stomach too much, like, and then after a while, it goes away.
Right.
I mean, like, um, let's jump into these questions because I feel
Yeah,
like
let's
we're
do
gonna
it.
get
These are
into.
great questions, by the way. So I have
So
answers for them as much
okay,
as possible. So they're great questions. So I thank you to all the guys who
yeah.
have submitted their questions so openly and honestly. I want to say thank you first and foremost to you and all of you for making this happen. So thanks.
So the first one is, when I do something that makes me nervous, I get a pee feeling. What should I do?
Great question, and piggyback of what you've experienced actually an hour ago or so,
Yeah.
right? So the pee feeling is normal to experience with nervousness. The bladder is innervated, has nerves that are both sympathetic and parasympathetic. And those are just big terms for accelerator and brakes on the nervous system. It's gonna ramp you up or or calm things down. So when you're nervous, this can either ramp up or down the responsiveness of those nerves that go to the muscles that are controlling your bladder. So you have a muscle that's not under your voluntary control. It's called the detrusor muscle on top of your bladder. But that is stimulated by the autonomic nervous system, which I already mentioned them earlier, where the sympathetic, which is fight, flight, or freeze, and the parasympathetic, which is rest and digest, and everything is calm. Now, in any situation for any different body, that can either, again, be ramped up or ramped down depending on the context. So here are a few things that you can do to calm the bladder down, right? One of my first ones that you already did so greatly was breathing, just kind of sitting with the sensation and calming things down by just focusing on your breath. Healthy distractions are another way to combat urgency. So phoning a friend, singing a song, counting backwards, getting involved in your work, reading a good book. So healthy distractions that are going to take you away from the normal adaptation of that urge associated with nervousness. You're breaking the cycle and you're changing it up. The third thing are actual pelvic floor muscle contractions. So you can quickly contract as if you're going to hold back pee and let it go. So we call them, rapid firing of those muscles. The reason why that works is because the muscles of the pelvic area communicate through a feedback loop system to the bladder. So when you contract your muscles quickly like that, it sends a signal to the bladder muscle to calm down and relax. Vice versa. Yeah, vice versa.
Actually, you're talking and I'm doing it really quick. Like, I'm like, oh, wait, it did calm down. That's weird.
Yeah. And it works. It works like a little charm. So, but most guys too, not most, but some men will complain that it makes things hurt more down there. So if that does happen, then don't focus on doing those contractions, but focus on down regulating the nervous system through, like I mentioned, the other two, breathing, healthy distractions, and again, breaking up the situation, the associated nervous trigger that you get with the bladder urge. So changing it up, changing your routine. The bladder is very behaviorally trained. So if you go on every time you have a sudden urge, well, you're training your nervous system to go in that short amount of time every time.
Yeah,
So
just to continue, I just want to make sure to confirm something. Everybody's different, right? So
yes.
it's like you're giving these tools, but you kind of have to go down the list of things, right, before you can find what is affecting you.
Right. And and I'm just breaking this down very general and very generic. So what works for one person might not work for another, which is why getting individualized, personalized treatment plan is very important. So anything that we're discussing, that's a good point to bring up. It's just a disclaimer, like this is not to take place of professional medical advice from your own provider. I have not seen or treated anyone who's watching. So it is not specific or individualized. These are just global general tips and tricks that work for the general population, let's say.
Yeah.
Okay.
Because I think a lot of people say, oh, that didn't work for me. That's not working. And it's like, you kind of have to go down that list, because I know there's certain things that I read that I was like, that doesn't work. Luckily enough, the stuff that I read really affects me in a way. And I've had it for such a long time that I know it's coming. I know what caused it. And you get kind of, is it me, or you just get kind of used to it? Like today I had the P feeling. I was like, oh, here we go with this again. And I just continue on my work, and then it's there. Like it's just doesn't, right?
Yeah.
Some days it's
some days it's there, some days it's not. Again, depending on context. Pain always relies on the context of any given situation. So, you know, it's like you mentioned, the pimple. Sometimes you'll have a pimple that's there. If you leave it alone, it goes away. But if you start poking at it, worrying about it, you've got a school picture you have to do, and you're trying to throw the kitchen sink at it, what does it end up looking like?
Yes.
Worse.
Totally.
Right? It totally looks worse.
I'm not gonna bring my girlfriend into this, but this is a pimple conversation, because she's gonna get mad. But yeah. So just to piggyback something that you said, and we're talking about now. There's a difference between pain and a P feeling, or we're talking about the same thing?
It depends on the person. So whatever that person is feeling, like whatever I'm feeling, no one can describe. I can't even describe it sometimes. That's how complex it is. Like pain is like it's kind of like describing love for someone or describing anger for someone. There are almost terms that are indescribable, and you really can't find those things in your body. Like, for example, love, where do you find it? Anger, where do you find it? It's not in your fists. Love isn't, you can't find it in your heart. Like pain is a similar experience, whereas like you might physically be feeling the sensation. There might not be anything showing up on scans. So that's why it makes it even harder for someone to explain how they feel, because it just changes all the time. For most people. Now, for some people, they might feel it like it's constantly there. And again, legitimately so. Whatever it is that you're feeling it, and it's real because you're experiencing it. No one else should tell you otherwise. Period. Yeah, totally. You are feeling what you're feeling, and it is real. It's not in your head. You're not, if you say it's a 5 out of 10, it's a 5 out of 10. It's not a 1 out of 10. For somebody else.
Was differently, right?
Right. And again, validating your experience and being able to freely say your story, and for someone to really actually acknowledge, like, yeah, that sucks. You're feeling like it's a 10 out of 10 every day. That totally sucks. Instead of saying, well, that's impossible. You're walking around and moving, and you're going to work, and you're doing all these things. How could it be a 10 out of 10, right? Right?
Everybody says that. Everybody.
I know, right? So
they're like, how again? It's like, what am I supposed to do? Just lay in bed and just cry? And
right.
Some people are, though. Some people are.
Right.
Some people are. And that's the thing that why I'm making this is like to show people like I personally think if I didn't have my own business in Japan, I probably would have just stayed home and been in bed, and but the fact that I had to make this money, and I just opened up the school, and this happened, like it motivated me to continue going forward. Right. And there's people right now who I'm in contact that are home, and I want to give them more hope. It's really difficult because we don't know what's going on in their bodies or mind.
Right, exactly. In their situation, in their life, in their world. Exactly. Yeah. And right now their world is upside down, and it's really hard to see answers and recovery and the light at the end of the tunnel when you're in the shitstorm. Yes. You're not watching the shitstorm behind a window pane. You're actually in the shitstorm. So what we're trying to do here is put hope back on the table, get you back inside so you can watch the shitstorm from the inside and not be in it. And and that's those are two different concepts right there for someone, like for me. And I'm talking specifically for me and how that experience was. I could either be in it and be totally dark and gloomy, or I can be safe inside my house watching it and not letting it run my life, essentially.
Let's jump into the next one because we can go off tantrums.
I know, Michael. That's what I'm saying. I'm so comfortable talking with you. I'm
trying to stay on point. I know I can see the people. Just go to the next one. Answer the questions.
Okay.
Can I work out? Can I do yoga? And before you answer, I'm gonna say that I work out still almost every day. And when I mean almost every day, it's to do with the fact that my schedule doesn't allow the workout. I don't go heavy anymore. I'm 35. I don't go heavy. I don't need to prove anything to anyone. I do it for maintenance of the body. But I also am worried if I go too heavy. I don't think my pelvic muscles are ready for anything heavy, especially overhead. So I do it more of like, let me keep maintenance. Let me keep doing it. When I do legs, though, I feel it that night and the next day, 100%. Like the pelvis area is affected. But when I do other areas, it's fine. Yoga affects the pelvic area totally. So before you say anything, that's my experience for the people who are watching. Now, doctor, please.
Nice. Thank you, Michael. So working out is definitely recommended. And I think yoga is a great movement activity. Yoga in general is a mindful movement practice that combines breathing while you focus and try to relax with movements and certain postures. So that's why it's really great, because it does calm the nervous system down. So something like a restorative flow type exercise can help regulate your nervous system. Again, yoga, tai chi, qigong, those types of things. It calms and enhances your nervous system response and your immune system response, which is really important. Your immune system and your nervous system communicate together. Without the immune system, the nervous system would not be able to work. So how much, and this is what you're talking about, Michael, is when I do X amount of exercise, or I do this certain type of exercise, that's the amount of dosing that you're giving to yourself. So how much, when it all depends on your own baseline, your own activity tolerance, where are you starting? You have to have some sort of starting point. It might be small, it might be medium, it might be large, but you are starting somewhere. Now, you'll need to dose those activities accordingly using the principles of feeling, quote, no worse after the activity. So if you find that you're flaring up 2 hours, 12 hours, 24 hours later, and it's lingering for 2 days, then you have to look at the situation from a global perspective, a really wide lens, and say, what did I do in that day that tipped my cup to overflow? I like to use a cup analogy or a bucket analogy. It overflowed. So what was it? It wasn't just one thing. Most people try to point their finger at, oh, I did this and it caused that. It's a combination of events in your entire day or the subsequent days before that that accumulate over time and can push, overflow your bucket, essentially.
Yeah. I have a personal experience with that. Like I was talking to you about it before. I did a trigger point massage 2 days in a row, really deep. It was so deep, it left me bruises. And I tried to do yoga, and I just paid for it that night. I was like, I thought it was the yoga, but it wasn't. It was the combination, just like you said.
Right. So again, it does take some work on your part to reflect inward and, inside, but also in your environment and your daily activities. So it's not just exercising, it's what is going on in your day that needs to be dosed and checked out. So it's your general life and your lifestyle. Balance is the key.
Yeah, 100%.
Yeah. And then you build up from there. Like I said, you dose small and you build up. And a good friend of mine, a colleague, his name is Greg Lehman, he says you got to calm shit down and build shit back up.
Yeah, there
That's
you go. Exactly.
kind of what you got to do.
Do you have I do the P90X yoga routine, and I think it's way too difficult for people with me. Now I'm getting used to it, so I'm getting stronger. But is there a yoga routine online that you've seen that you recommend for people, or a exercise routine that you recommend for people to do?
I do. So there's Yoga with Adrienne. She has a YouTube channel. It's a great channel. There's also Fem Fusion Fitness, Dr. Bree Grogan.
What is it called? Fem? I'm writing it down. So
yeah, we can link it too, hopefully, in the YouTube notes, because I've got some other helpful resources. But Fem Fusion Fitness, and that's Dr. Bree Grogan. She's also a pelvic floor therapist stationed out of Germany, actually. And free resources. She's got everything for pelvic pain, for core, for just some great tips, and for men. So it's just because it's a fem fusion, It doesn't mean she doesn't have things for men.
Yeah, I was thinking, I was like, fam, I was like, okay. But you know what? I thought before I got into yoga, I was like, I'm not doing yoga. This is BS, blah, blah. And my first yoga routine, I said, what? I've been missing out. This is way harder than weights. Like, this is so difficult.
Yeah.
It's actually super difficult. It's super, super difficult.
Yeah, think about it as broga. It doesn't have to be yoga.
Yeah.
It's just broga or movement, mindful movement. I mean, just keep it really simple. I know some people think it's granola, but it's not that you're doing anything special or yogic in nature, but you're just tapping into your body sensation. You're paying attention to the feel good, the not feel good, the neutral parts, and you are accepting that and modifying and moving your body. And motion is lotion, essentially. And in order to get better, you have to load your tissues. You have to move. Everything needs blood flow, movement, and space. So, it's really important.
So those people who stay in bed, like all day long, I would think that once you get up, it's gonna affect you.
Yes. Yeah, it's gonna hurt. Because you're doing something different. And if we're so protective and guarding everything, how are we going to get better or more resilient with stressors, right? So the body has to be loaded. You know, we know for a fact in science and literature that exercise does help people get better. We just don't know what kind of exercise, how much, you know, when is a good time to add it, you know, what to do first. And again, that's why I go back to, you have to be collaborating with someone who knows what they're talking about with pain, firstly and foremost, and who has knowledge about the down below, to put the two together to get you on a program that's suitable for your own individual needs and body.
And that's the problem. And I feel like that's why, another reason why I want to put this out there is that there is not enough people who know. Even the urologists themselves, they don't know. And there's been plenty of people that I've spoken to who take the book to the urologist, and it's like, listen, look at this, please, because it's frustrating to go to the doctor, and of course the doctor doesn't know everything. People, it's impossible for them, but you know that feeling of I don't know, or the feeling of this is what you have, and then you know the catacombs of the internet telling you you're gonna have this for the rest of your life, and you have this, and it's like, come on, this is crazy.
Well, they say there's a stat out there. The more stress you feel after a healthcare visit 6 months later, like, so if that stress is still there going on 6 months later after a healthcare visit for a situation like pain, the more stress and the more helpless and hopeless and the greater pain that you will have in a following, like, a year. So it's going to continue. And so that's why I think what we're doing is great, because it gives people hope. It gives people like quality education and evidence-based material based on modern pain science and things that they can do. And really, again, like you said, there's a lot of crap out there on the internet, and it takes a lot of energy and strength to weed through the bullshit. And when you're in pain for such a long time, or it's freaking you out, the last thing that you're going to be having energy for is going through and finding out what the good stuff is. And not to mention, when you're already in a negative state, your brain is going to naturally pick up on all of the negative information that's out there. You can have all the positive stuff right in front of you, but the negative stuff is what's going to be up in the forefront. You will ignore all that other stuff.
It's like when you have 100, there's 100 comments and only one of them or two of them are negative. That's what you're going to focus on. And it's crazy. It's the way humans are. And before I forget, this is going to be another question, but you might as well tie it in here. What do you say to the misinformation that's on the internet? Because there's tons of people who say that we don't have this, right? So I'm not going to mention who, but someone who's going through it, he said, oh, I'm never going to get better. I read online, someone posted that we have a film line, and this film line is infected and the doctors can't, and da 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 da. And what do you say to those who are non-believers, I guess? How would you not try to convince them, but acknowledge because what I tell them is like, if you believe that, then believe it. Like, there's nothing that I can say. I give you the information I know from personal experience. Look at the science. It's literally science that's there. If all doctors would follow the same thing, you wouldn't believe the other stuff on the internet. I guess, how do you feel about it would be a better question, because there's nothing really you can say. But
Well, I liked your answer, Michael. I think you've hit it on the head. We will believe what we want to believe at the end of the day. And what you believe, your values, your beliefs, your thoughts about what's going on in your own life is going to shape your perspective. It's going to change your reality and change your world. So think about writing in stone, essentially. I use like that metaphor a lot. You know, it's like writing in stone. That type of mind is very difficult to change.
Okay.
If you have someone that has a mind that looks like writing in sand or writing in water, very flexible, right? Very flexible, changing, ebbs and flows, goes with the flow, literally. So, you know, at that point, you know, having a lot of energy to change someone's perspective, you won't be able to do that. That's an internal experience. That's like behavior change. That's like somebody wanting to quit smoking or lose weight. You know, the motivation has to come from within their own self in order for that to happen. Now, as a coach and as a practitioner and a provider, you know, I meet that person where they're at. And the treatments are guided by where their starting point is. And there are some difficult conversations that I do have to bring up saying, you know, there are certain things that we know that do help. How ready are you to implement these changes? And I put it back on them, you know, because the healing doesn't come from me. It doesn't come from me. I'm not fixing people, and I don't claim to cure or fix people. No one can do that. It's the person and the individual that has the power to do that. And so I bring it back on them to say, you can do this. I give you the tools, like you're saying, Michael. I give you only my own experience and what has helped me and others. I'm just sharing that with you. So you can lead a horse to water. That's what they say, right? You can lead a horse to water, but you can't make him drink it. So
100%, 100%.
That's what I have to say about that.
How often should I get massages and do the stretches?
Okay, so how often is a good question. And the best person to answer that question, guess what, is you. So just like I mentioned earlier about dosing, the goal of massage and stretching should be to make you feel good so that you can function better. Any treatment modality that you choose should help you function better, improving your life and helping you feel empowered to be better able to handle any physical and or emotional stressors that might come your way. So some people need more upfront initially and then wean off, while others need less initially in the beginning. So it really just depends on the person. There's no universal protocol. So whatever you do and how often you do it should fit your own lifestyle.
And that also goes by how getting cured, right? People say that, people always ask me, how long did I see results? And I saw, honestly speaking, when I read the book and it said that you're supposed to relax your stomach, I instantly did it and I saw instant gratification. Of course, the feeling came back a couple minutes later, but I was like, oh my God, this is much, at least I can try to control the feeling or try to control what's going on. So there is no time frame. And I hate to say it, but it might be forever, but it's not as bad as it's going to be right now. And it's totally manageable. Like, and if you have a life partner and your life partner understands you, because my girl she's used to it already. She's like, oh, you're in a bad mood. You feel it. And I'm like, yeah, I feel it. She's like, all right, let's do something. Let's calm it down. Like she's, you know, and she's really, really good with it. And my girlfriend gives me massages usually a couple times a week. She knows where to hit, where it gives me release. And it turns into a routine. I guess I'm a person of routine already in my whole life. So it's more of a routine. You get up in the morning, you do a quick stretch, you warm up, you do a couple more stretches. When you're in the shower, you do a couple more stretches. When, you know, I've had a long day and I have a free time, I lay out myself on the carpet and I do a quick stretch. It doesn't have to be all the stretches at all the time. You know, you kind of learn to just deal with it. And you, like you say, you have your bad times and good times, but it's like, I don't know how to explain it. You have it, but it's there, but it's not as bad as what people expect it to be.
Right. Well, and again, it's the value we place on what's happening in our body, right? How threatening is that situation in any given context, right, for anyone. But also, like you're saying, like, yeah, it'll come and go just like colds do. Sometimes you wake up and you have a cold and you don't know where that came from. But you know the cold isn't going to last forever. And when you get another cold at some point in the future, it's not the same old cold that you had last year, right?
Yeah.
So just, it's not, that's what the issue is. I think we get into this state of catastrophizing and thinking that, oh my gosh, this thing is back to haunt me. It's the same thing. But I like to tell people that, well, again, like the cold thing, it's not the same cold that you had last year. It's different, and
Yeah, it
you'll get
does.
better, and it will get better, and you're not going to have it forever. And another analogy is just like a paper cut. Well, paper cuts don't jump from this finger to this finger. It's just because you have one here and it heals, and then you get one here. It's not the same paper cut. So, know that just because you're feeling it down there and it ebbs and flows, that you're not re-injuring yourself, or it's not coming back to haunt you full force. You mentioned the pimple analogy. Pimples come and go. They might come in the same spot too, but it's not the same pimple.
Yeah. I actually, to piggyback off what you're saying, I feel like mine has transitioned. Like the same thing that used to work before doesn't work now. It's totally different in a different, a totally different place. But I also know that if I would have done what I'm doing now beforehand and kept it going, it goes away. When you stop the routine and then you go back into your normal day life, it comes back. It's like, and I picture it more like, I think you wrote it in your book. It's more like, this is a warning. Like you can literally get worse, and not like this. Like imagine like a muscle tearing. Once you tear a muscle, replacing it is so difficult. This is like hey, you're doing something wrong. This is where the pain is coming from. Chill out what you're doing. Or if not, it's going to get really, really bad. And that's what I've learned. It's like, I took it like as a warning. There was something that I was doing that was really bad that made it worse. So you take it as a positive. Like the shit could have torn down there, and there's nothing you can do with a torn muscle down there. Like nothing.
Yeah, it'll take time to rehab, or you need surgery, right?
Yeah, exactly.
Yeah, and it goes for anything, not just pain, but anxiety is another good example of that. If you're not paying attention to the small little messages you're getting and how your body is feeling throughout the day, it accumulates, and then your bucket ends up overflowing, because the ability for us to be resilient with stressors ends up to being too much to handle.
Yeah.
And that's why you put out the fire sooner than later.
100%. Next question. How do I know it's pelvis pain, not prostatitis? I'm actually very curious what you're going to say to this, because because of the stuff that people write, my heart is this pelvic pain because of cause and effect. I do this, I get this sense of relief, right? So I know that it's my muscle. But you hear the stuff on the internet, so I'm really curious what you have to say.
Sure. So true prostatitis will typically show up on lab tests specific to testing prostate fluid. And what they do is they do a pre and post massage analysis of the prostatic fluid. But some research has shown that even having inflammation in the prostate, it does not necessarily lead to having symptoms. So true cases of prostatitis technically should resolve with proper medical treatment using antibiotics or medications. But in some cases, even after the infection clears, some continue to have pain that was initially triggered by the immune system. So there are many other contributing factors that might lead one person to have persistent symptoms while others don't. But honestly, we're still not really sure as to what combination of these factors may be for any given situation in any given individual. So it's really, pain in itself is a complex phenomenon and very individually based. So it's not just muscle, it's not just, itis or inflammation. It's everything, all your systems of your body, your mind, working together, and interplay with one another.
Mm-hmm.
So that's what I can say about that. But there is no single known cause for what causes what.
And also a lot of doctors don't even do it. They don't even do the full test and say that you have prostatitis.
No.
They don't do it. So all these people say, oh, the doctor said I have prostatitis, and it's a like, if you have this certain amount of symptoms, the doctors just say, oh, that's what you have.
Right. And it's not always true. In fact, it's very rare that there is an actual infection present. They say 5% of the time it's only an infection. So again, take it with a grain of salt, but the urologist should do they call it a 2-Mears-Stamy test. And that's a quick procedure as well to actually test the prostatic fluid under a microscope, to really check to see what that fluid has. And if you do need antibiotics or medication, then great. And then you can actually be more specific to what kind of antibiotics you need for that particular issue going on.
And they should ask, right? You should ask the doctor to do it, right?
You should ask, absolutely. If that is the diagnosis that's being given, then I would certainly ask, well, let's do a prostate analysis to see if that truly is an infection. Because the problem is that you'll get a lot of medication thrown at you. And I'm sure a lot of the guys out there will agree, it's medication, antibiotic after antibiotic. And that's not cool for your body, because you start to become resistant to those antibiotics. And when you really need them, your body is building resiliency towards that. So you don't want to be haphazard with the amount of medication that you're taking. And a lot of those medications do change the gut bacteria and the gut flora. And we know a little bit, research is just coming out about the gut and the microbiome and the little bugs that live in your gut, how they can impact the immune system. And guess what? Your gut and your bladder and your prostate, they're communicating with one another. Like, these little bugs are everywhere. I mean, they make up your whole body. So if there's an imbalance with that due to over medication or overuse of antibiotics, well, then that adds another layer to the issue.
The side effects that I got from the medication they gave me made me feel worse. Once I got off of it, I felt much better.
Right. So anyway, that's my answer to that one.
Okay. Are there any stretches that can be done while sitting? Is there anything you could do? Like, everybody has to work sitting. Luckily enough, I only have 1 day or 2 days that I sit for a really long time. Most of the time I can get up and move around, so it does help. Is there anything that could be done that while sitting at the office on the computer to?
Yes, I love it. Good. And I'm glad that you mentioned that, Michael, about what can we do sitting, and that you take breaks. I think everyone should take breaks from sitting. Our bodies are not meant to sit in any one static posture for any length of time, like greater than an hour, I think. Again, I don't have this isn't true statistic, but we're creatures that are meant to move around. And like I said earlier, your body to be healthy needs blood flow, movement, and space. So 100%. Your tissues need that. And so you need to take a break. But anyway, if you're sitting and you want to get something done and you need to take a little quick break while you're sitting, you can do your ankle, cross your ankle over your knee. I don't know if you guys can see.
Yes, try to stretch, right? By grabbing your ankle, right?
Yeah. So you take your ankle over your knee. And you're sitting, okay. Essentially like that. I mean, but I'm trying to show you because I'm short in my chair. Another thing is sitting, bending forward to touch your calf, touch your ankles, or touch the feet on the floor. So you're kind of bending forward and grabbing your ankles or your feet, whatever is easier for you to grab. I like that too, because you're stretching all the nerves of the back, the tissues of the back, and your pelvis. So when we talk about the nerves of the pelvis, this is a really good stretch to just kind of create space in the back. You can also sit upright and then stretch your leg, your bottom leg straight. So you can extend your knee, bring your nose towards your toe, bring your toes towards your nose. And then you'll get a nice stretch in your calf. Or it might feel like a little nerve stretch, because nerves can feel sometimes you can get a little bit tingling. Sometimes it'll feel I don't know. It's hard to describe, honestly. But it won't feel like a muscular stretch. It'll feel like more of a nerve stretch, which is fine.
What I'll do is we'll discuss it a little bit more, and I'll make a video and post it for people, because I think that's really interesting. I think a lot of people spend a lot of time sitting on their seats all day long.
Yeah, yeah. And then upper back stretching is one of the other favorites that I like, is, you know, sticking your belly out, bringing your arms to the side like a cactus. You know,
That'd be really cool to do in the middle of your office. Feel like, what's going on?
Yeah, well, or you can bring your hands behind your back and stretch.
Yeah.
But again, these are postures that, you know, you're letting the light in essentially. Most people, when they're working on their computer, are very flexed, curled in. Everything is going inward, and we're not doing enough of the opposite. Yeah. And that's where we get in trouble. It's not that posture sitting is bad, is that we're not getting enough of the opposite. And we're not getting enough variability in our day. So if you can get up and walk around, get up and walk around, do some breathing, you know, take 10 steps and breathe, and then come back to your chair. You know, that there's nothing wrong with that. In fact, you should be doing that to maintain healthy, you know, healthy body.
Yeah, the iWatch makes you, like, the Apple Watch makes you do it. Like,
oh,
it's funny.
good.
Every hour it gives a bell, like you got to get up for a minute and come back, which is actually really
that's awesome. See, that's really great. And it also has a breathe app on there too, right?
Yeah, and it's like I was like, I was thinking I have to create like an app that works with this for everybody here who has the same problem, because that'll be awesome. Because it's already doing it. It's doing a bunch of stuff that you're saying, so it's awesome.
Yeah, awesome.
To piggyback off that, does diet or fasting actually work? And before you say anything, I'll give my take. I literally eat whatever the fuck I want, first of all. But I eat it if it fits my macros. So I eat macro dieting. But people say, oh, don't drink coffee. I drink shit tons of coffee, especially on a hard day. And I don't feel any effect. Now, I don't remember what a normal toilet user is, because for as long as I can remember, I eat literally shit almost after every meal. I've been like that forever. Everybody knows that I'm a shitter, so I've had that forever. Awesome. And also I remember peeing like every 40 minutes for as long as I can remember, because I drink so much fluids.
Right.
So it doesn't affect what I would say affect me, but if I use the toilet more often, it does irritate me. So I don't know if that goes hand in hand.
Like number one or number two?
Number two, if I let's say I have to run to take and I have to like run out, I didn't have the time to breathe and kind of relax my muscle to use it, and I noticed that I don't get everything out. Like the last trickle doesn't come out, and that's what affects me. Like I have to go back. So what I try to do is I try not to rush either one or two, because when I rush it, I 100%, I'm like, oh, and then I have to do the breathing and stuff, and then, you know, but now I'm at a point where I force myself to go after every hour, because I don't want to, I don't know if that's good or not, but I try to at least an hour. If I'm not drinking heavy fluids, like after 8, I try to not drink a lot, because I know that it's gonna take a while to let out, because I don't know what I don't know what a normal person pees like, because I've forever known that I use the toilet quite often. So do you think it affects it, or
like diet? Okay, so let's go back to like the diet question, and I'll address the issues that you mentioned with the bladder and the frequency. We'll tie that in, actually.
By the way, 6-7 people, have you noticed they're actually viewing? They're still watching, which is pretty funny.
Oh, I can't see anything from my end. So
it's been up and down 6 and 7.
Those are some troopers.
That is.
That's awesome. Okay, so does diet and fasting actually work? Okay. Diet is a hot topic, as you know, these days. And I'm not a nutritionist, but I know that there isn't one diet that's the best for any one body type, okay? Now, this depends on the person, their body, their needs, their financial status, and their accessibility to food, you know? Like, some people just can't get quality food on a daily basis. So we have to take that into consideration when we talk about diet. So what is good nutrition? Well, there's not just one answer. It's a combination of eating in a way that helps you get the minerals, the vitamins, the good fats that you need to sustain health and life and to keep you at optimal healthy levels. Okay. So it's very individualized. Again, I can't stress that enough. People want clear-cut black and white answers. I do not have them, and they don't exist. There are lots that will claim that, but it doesn't work for everyone, because if it did, we'd not have any problems.
Yeah, you would have a standard, right?
Yeah, you'd have a standard and there would be no issues. And we know that.
What is the gluten? That's the one that everybody brings up. They're like, that gluten is what's causing this. And I'm like, I eat fucking bread all the goddamn time. Like,
right. Well, it could. And again, you're in Japan. So the way things are made in Japan might be different from where they're at, and so forth and so on. So again, it's your bioaccumulation over your entire lifespan. So you might have grown up on really good quality wheat or whatever that may be. I mean, your situation is completely different. And the way that your body responds, your genes, your bacteria, it grows and evolves with you and changes with you over time. So really, again, it's all about figuring out what works for you. And the best thing to do that is any diet plan that you choose, that you do and you choose to change, make sure that you feel good and that you're nourished. So after you eat something, check in with yourself and ask, does eating that food or drinking that thing make me feel good? How about the next day? How do I feel, right? So if you know you eat something or drink something that makes you feel shitty or crappy, then you know that's a trigger. Right. So, but again, it doesn't mean that you can't have that. Like, for example, for me, it's sweets. I like sweets, but if I have too much of it, it makes me feel like shit the next day. And the day after, like, I'm foggy. My muscles are achy a little bit more. I've got more sinus congestion and allergies. So, but I know what's causing it. So if I go to a friend's house and they make cookies, I'm going to have a cookie. But I know that just one, right? Like moderation. But I know that the aftermath, like I might feel like shit. Okay.
You're that sensitive?
Not that sensitive. In the beginning I was, but I went through a whole like protocol of changing my diet, cleaning it up, and now I'm okay. And that's the goal. Like when you do eliminate these triggers, eventually your body is going to come into balance. And when you do have a cookie or two or a drink, it shouldn't push you over the edge. Everything should be calmer, right? But that's what you're building up to.
Is the triggers. That's something that you mentioned in the email. People don't want to figure out their triggers.
You've got to figure out your own triggers. No one can do it for you. You can have somebody like me or another person who can coach you to help you figure that out by asking the right questions, giving you some handouts, a journal. Journaling is helpful. You know, like just figuring it out, because trust me, you're not paying attention to it during the day. You're too busy with everything else to distract you, and you're really not focusing on connecting the dots. And so having someone to really kind of focus in and keeping you like, you know, straight in your lane.
And even then it's really difficult.
Right. So anyway, but the diet thing, this is a good quote. A friend told me this: garbage in, garbage out.
100%. Too much garbage out is going to affect you.
Too much garbage out is going to affect you. Like you're saying, like if I have to go to the bathroom frequently and having bowel movements is painful, well, then we really need to look at your diet. Or if you're constipated and that's adds pressure in the pelvic floor to your bladder, to your prostate, like we need to look at that. You know, if those are some of the triggers. Again, it might not be for everyone, like for yourself, like, you know, your body and how it works. You know, could you potentially increase your time between voids? Sure. I think 2 to 3 hours is a good window to hold pee. And if you really analyze your own life and see, okay, am I always going every hour, or are there times where I'm distracted enough where I can hold it for greater than what I think? And most likely, now I'm not speaking for everyone, but most likely you will find a couple of instances where you were able to hold it much longer than you thought. And that's what you got to think about. And you got to contemplate that and say, okay, if I can hold it then for that much, what makes me think I can't train my bladder to do it longer during the day? But it's routine. That's the thing. You get your routine. you start to create these habits, and habits are difficult to change unless you become aware of those habits. And when awareness is key. And once you're aware of what you're doing, you can then change it. But without awareness, you cannot change anything.
Yeah.
So anyway, that's my thing about diet.
Are you going to say something about fasting? Or no?
I don't know enough to talk about fasting. Okay. I do. Well, I take that back. There's a book called Heal Your Pain Now by Dr. Joe Tata, who's also a friend of mine. He's written a book. He talks about keto fasting or keto diets, and he has some research to support that. Again, it works for some people. It may not work for everyone, because what if they have really, their blood sugar isn't regulated that well? Or, for example, when you're fasting, listen, guys, you're going to sleep. If you go to sleep at, let's say, for example, you stop eating at 8 o'clock and you're not snacking, and you go to sleep and you wake up at 8 o'clock. Well, guess what? You just fasted for 12 hours. Was that 12 hours? 8?
Should be 8 to 8, yeah.
Yeah, I was like, wait, was that 12 hours? Yeah, so you should, that's your fasting. That's when you're fasting. You shouldn't be starving yourself during the day. But if you cut your meals and you're not snacking at night, you eat, you drink, 8 o'clock, let's say that's the last thing you have, that's great. And then you go to sleep, you have a bedtime routine, and you get enough sleep. I mean, that's enough fasting. Your body does what it needs to do at nighttime to repair and to heal and to get enough energy for the next day, and so forth and so on. So that's why sleep is really important.
I don't fast, but I try to finish eating early. So I like to go to sleep with I try to avoid the nighttime poop personally. Yeah. And I stop eating. Like today I ate, I think my last one was at 6 o'clock. And I'll probably have a drink to relax when I get home at night. So people say, oh, don't drink alcohol. Listen, I fucking drink. In Japan, people drink heavy. So I like enjoying having a strong drink at night before I go to sleep. And it helps me relax tonight. For me, I can battle the pee feeling during the day. At nighttime is when the ghosts come out. And for me, it's difficult. So I'd rather any means necessary to go to sleep.
Yeah, because it's really important. And you mentioned alcohol. There's a question about alcohol. You want to just talk about it now?
Yeah.
Because there's the last question.
The last one, does alcohol affect it? Yeah.
You want to talk about that now?
Yeah, we can. Yeah.
It's a good segue. So yes, alcohol can affect your body, your pain, your sleep, your bladder, your kidneys, your liver, et cetera, right? But for some people, alcohol might calm them down initially or help you fall asleep initially. However, what most people don't know is that all that sugar from alcohol, because it breaks down into sugar molecules, has to be metabolized. And that creates more work for your body to detoxify, which means your liver is working harder, your kidneys are working harder, and so is your bladder. So the alcohol can keep you wired, tired, or even your heart racing. For me, if I had too much to drink, like at nighttime, I'll wake up with sweats and my heart is racing.
Yeah, I thought I was the only one. I was like, I don't remember having this as a kid. And when I drink heavy, my heart is like,
yes. Yeah, that's physiologically what alcohol is doing. So, again, sugar has been shown to be pro-inflammatory. So keep that in mind. Like sugar, alcohol, it is pro-inflammatory, meaning it increases your immune system. It increases the inflammation in your body, creating your immune system to work harder. Alcohol acts like a diuretic, making you pee more and exacerbate urinary urgency and frequency. Alcohol is also a depressant, and those that have pain are already kind of sad and depressed about the issue. So this can make their mood worse, which perpetuates the pain cycle. And lastly, I want to kind of mention about how much is too much, right? Again, going back to dosing. If you know how it makes you feel afterwards or the next day, then you know the answer to this question. Yeah. So I know for me, and I mentioned this already, hangovers are the worst to deal with. Like the worst. When I have like 3 drinks or something, if I have one, I do really great and I feel fine the next day. So I know for me, having one cocktail once a month, like that's all I have, if anything, I feel pretty good. Okay. So when you're in pain though, and your body and your mind and everything is working towards putting all the energy towards stopping pain, right? Because you're not just sitting there with it, not doing anything about it. You're really actually thinking about it so much that all the energy is going into that first and foremost. That gives you less tolerance and reserve that you'll have to bounce back from a crazy night partying. Okay. So only you can really evaluate this, like you did, Michael. Like you figured, you know, you're like, when I have this is how much I can do, and this is what makes me feel good. So give yourself that honest feedback and really reflect in your own world and your own life, because that's what's going to make the difference of what to do, how much, when. It really does depend on you as an individual.
It helps me to relax. So. But I also agree that when I drink too much, I can't sleep, and it makes it worse. So
right,
I just have enough to like, you know, to relax, and then cut it from there.
Right, exactly.
Is estrogen to blame for our condition?
Well, based on our conversation, you probably know the answer already to this a little bit. So I don't think anyone can say with certainty that estrogen is to blame for chronic pelvic pain. There isn't a single known cause that I'm aware of or that anyone's aware of. Estrogen is a hormone, and it is interdependent on the other systems of your body that regulate homeostasis, or in other words, balance. So both women and men make estrogen, and it plays an important role in our health. Now, estrogen in men, like the belly fat, so if you have a lot of fat around your waist or your waistline is big, we know that fat will take testosterone and convert it into estrogen and store it in a man's body. And that can create a pro-inflammatory cascade, which can obviously works on your whole body. So that can impact your health and your cardiovascular health and so forth and so on. So again, it's about that balance and the driving factors or triggers when things do get out of balance. And again, really knowing who to work with to be individualized for your own body type and your own needs. So no, estrogen is not to blame, but I'm not throwing the baby out with the bathwater. If you look at the context of the situation for any given individual, it may play a role, but not for everyone. Okay. Not for everyone. And there's no literature to prove estrogen anything other than, you know, in obesity, and also with sexual dysfunction, like erectile dysfunction. Again, that's because of the hormone cascade and things going from testosterone to estrogen, and that's why you get man boobs.
Actually, mine. I was like, I've always been. I think I have high levels of estrogen because I feel like I got man boobs and big hips. So
no, no, you just got big pecs.
That's what it is.
It's all muscle. It's all muscle. Yeah. So again, it's you gotta work with somebody who knows what they're talking about in terms of that. And again, really there are endocrine disruptors like in our world. Back in the day, you didn't have a lot of plastic, you didn't have all these toxins or pollution and pesticides and all that sort of thing. And there is some literature coming out on that saying that it can disrupt your endocrine balance, your hormone balance, plastics, where are you getting your drinking water from, your food, all of that can, again, accumulate over one's lifetime, creating a disruption in the systems of the body. So again, that's very generic, but there's some inkling that can disrupt certain processes in the body.
Let's jump into the next one. What do you? Well, we already answered this one a little bit. What do you feel about the medicine that doctors are giving people for prostatitis?
Yeah, it's a good question. So we already touched base on it in regards to antibiotics. I'd like to go back and say the common medications prescribed for prostatitis, we talked about one is antibiotics, but you also have alpha adrenergic antagonists, or another name for that is alpha blockers. And these medications work on the nervous system to relax muscles and increase blood flow to certain areas of the body. So those medications are sometimes given for people that have issues with peeing or urinary hesitancy or urgency frequency, because it relaxes the muscles around the prostate and increases blood flow to help you pee better. But again, for some men that might help, but for others, most men it doesn't.
It didn't. It made me worse.
You had it. Okay, you had it. Okay.
It made me have a feeling that it, like, somewhere inside it was vibrating. So I guess like the muscle, the nerve was like going haywire, and the muscles trying to relax. And that's once I got off that, I was able to sleep. When I was on those things, I couldn't sleep. Like it made me want to use the toilet more, and I was like, I want to stop using the toilet. Like, oh no, you're supposed to take it to help you to take everything out the bladder, but there's nothing in the bladder, and you're having this sensation.
Right.
It literally drove me insane. And I tell people not to get off them if they can, because I don't think it helps.
Right. And again, it may, if the situation for that particular individual does necessitate that need, it might help them. But for others, I'm with you on that. I get the same impression that it's not really helpful. The other thing that people are given are antidepressants or nerve medications. And again, hit or miss with these as well. For some,
to make you go to sleep, right?
Yeah, to help you sleep, to help relax.
I was on that shit too.
Yeah. So, again, give or take, everyone's got their own experience with how it makes them feel.
Yeah, that was not.
Right. The ultimate goal is how does it make you feel? And is it going to make you function better? And what's the plan in the long run? Like, are you going to be on these forever? How are you going to wean off of them if that's your goal? Sometimes people are on medications and they work initially, but they stop working because it's only temporary. So, having a plan for when these situations arise is going to make you much more prepared for future situations. So I think having a really solid plan of like, what if happens, what if this happens, what if that? And of course we can't plan everything, no matter how prepared we are, the tsunami's coming, it's coming. You know what I mean? And
read the side effects, because I was affected by the side effects and I didn't know what the side effects were. Right. And I was very heavily affected. If I knew that was causing it, I thought everything that I had, when I stopped taking the medication was I was in New York, and I was on my sister's wedding. I traveled from Japan to New York with this, and it was like, man, torture. Now I can travel no problem. I make sure to get a massage before I go out 2 days out, and I get another massage the day before, and I make sure to do the stretches before I get on the airplane, try to stretch, and I can go back and forth to New York no problem. But I was there and I started like losing my hearing because I was doing like pain medication, taking all this stuff. Like my girlfriend lost all her phones because we had to jump into taxis. I thought I was going to pass out, like all this stuff from all this medication. And that's when I was like, I'm not taking anything. And I stopped, and that's when I actually got better.
Great.
So
yeah, again, medications, they may be helpful temporarily. They may be like crutches are if you break your foot. You know what I mean? Like they're helpful temporarily because you're healing, but the goal is to get rid of the crutches eventually so that your body is resilient enough to take care of its own needs. And it is very powerful, and it has the potential to do that. I mean, there are some wonderful things that people have gone through and survived and have done amazing things. I mean, just look at the Special Olympics. So you have the potential. It is there. The seed is already there. It's just a matter of how do you grow that seed, and what are the conditions that need to come together, right? The soil.
Remind me of Pineapple Express.
Oh, what? I don't remember. What seed is that?
He's like no, he's in Pineapple. It's like you plant the seed and then you fuck it. Remember that?
I don't remember that. I don't remember that, but that sounds funny.
Oh my God. We got 11 viewers now. Can you believe that? 11.
Hi, viewers.
This is actually, I'm curious what you're going to say. Stretches don't help. What should I do now?
Cool. Okay. So if you've been listening, you probably know the answer already. However, stretches are just one piece of the treatment. Okay. So the best treatment, and I keep saying this like a broken record, but is the one that's patient-centered to you, multimodal. So it's multiple different treatments, individualized for your own body and your lifestyle. So to help you get the best result, again, my best advice is to make sure you get in touch with somebody, a pelvic health therapist, me, whatever, a consultation, so that you can understand the process of the pain that's happening in your body so that you can have a plan to navigate your recovery. So stretches can be very helpful. It's not that you're actually changing muscle length. It's because you're getting movement in your body and blood flow to the nerves, and you're helping your immune system. And I think that's what's helping when you're doing stretches. But it might not be the combination of things that you're doing that might be enough. You know what I mean?
I will say that just the stretching, I tried just stretching and it didn't help as much. When I get a massage, I call it trigger point because the guy's working with me and he really causes pain. Like I'm screaming some days. Like that's how deep he's going in there. But I want it because I know that if I have a feeling there's a tight muscle, and there is there. So I would recommend for people. It's really expensive in the States. It's thank God that Japan is so cheap. I pay like $20 every single time I go, and Japan pays the other 40. So it's basically a $60 session for $20 because insurance covers it. I just got one today. I got it in my lower back and in my neck because everything is connected. Everything is all connected, especially the lower back. But just stretching doesn't work for me. So I would recommend for people to follow the way, especially what you taught in the video, to find those trigger points yourself on your legs, especially on the adductor muscles and on the thighs, and try to do it yourself if you can't go to a specialist, because the trigger point release, and I forgot what the name is, it does help so much.
Yeah, it does. May I kind of add something to that, Michael?
Yeah, sure.
So I used to chase like trigger points a lot, like for my patients. I used to do that, and I write in my book and I have it in my program. For the past couple of years, though, I've started to shift my understanding of what these points actually are. And what they really are is not that the muscle is knotted. It's the nerve going to that muscle that's releasing certain chemicals that sensitizes the tissues. Now, for some people, like for you, it really helps you, and that's great. But for some people who are wincing and it hurts, treating pain with more pain is not helpful. So I don't want the people to get the impression that you need to hurt to get better, because you don't. And you can use manual therapy to calm the nervous system down, to decrease the threat of sensitivity. So if you have areas that are sensitive to touch, just to light touch, I definitely would not recommend going in and getting trigger point release, because it can be painful. And if you're treating pain with more pain, you might be doing more harm than good for yourself. So again, it's a fine line of, is it helping you, or are you gritting your teeth thinking like, I need to do this to get better, but it's not helping at all, and it's actually making you worse. You know what I mean? So, you know, trigger points in a nutshell have been debunked essentially. The name is holding very strong in both healthcare in general, and like however, we're trying to shift the word from trigger points, because people get really hung up on like, I got these trigger points and they're not going away and I'm not getting better, right? So we're trying to shift the mindset to say, hey, these are just tender spots or tender areas in my body, and I have them on my body, but I'm not necessarily in pain.
Yeah, that's one of the things. You might have them and you'll never even notice.
Right. And that's fine. And there's nothing like there's no, it's been debunked. There's no hibernating trigger point. There's no hibernating anything. It's not like it's going to come and haunt you if you don't get rid of them. But what we do know, it's more of a neurogenic inflammatory response at the tissue level, where nerves themselves release chemicals and backfire on one another, creating sensitivity of tissue, changes in tissue color, swelling. You know, nerves can do that. So it's not just about the muscle, but it's about the nerve, the container around the nerve, and then where the nerve lives within the tissues. And when you do manual therapy, for some people it does help, because you're actually mobilizing that tissue, decreasing the sensitivity and the immobility that's happening in the tissue. Again, you don't need to do intense trigger point release, both internal or external, to get better. You should be getting better incrementally over time. And if the things that you're doing are not working, then there has to be a change. That's what I have to say about that.
Okay. Yeah, for when I'm saying it hurts bad, is that I was working out and I wasn't stretching for years, and I was running like 10K every day, and I wasn't really stretching. When I mean I wasn't really stretching, I mean like I would do a quick and then that's it. I stretch way more. But I had some knotted muscles for years in there that I never took care of them. So, but I like the pain. I know that once I have the pain, the release comes. So I enjoy it. So
yeah, see, so again, it's very individual, and that's cool. Like, more power to you. Like, that's awesome. But again, for some people who that doesn't work for, like, know that you don't need to hurt to get better. Yeah, because I have some patients that take, like, I've had patients in the past who've come from different therapists taking medication, pain medication, just to tolerate therapy. That's not okay.
Yeah, that's not.
You know what I'm saying? So that's what I mean. Like, know that if you're nervous, you're scared, you're tensing, you're guarding, while you're getting a treatment, you're just feeding that perpetual cycle of threat, protection, and more guarding. You know what I mean?
Yeah.
So.
And to the last one, my back pain is so bad. Please help. That's like when someone does the back pain does affect, right?
Because it's all connected. The same nerves from the back and the sacrum, which is the tail end of your spine, they connect multiple different highways across different levels of the spinal cord and nerves. So there's a lot of crosstalk in that area. So yeah, like, neighbors like to be nosy. And anything around the pelvis and in the pelvis will light up if there's an issue going on. So first of all, to the person who stated that, I wanted to say, sorry that you're experiencing the back pain right now. I can only imagine how difficult and hard it is for you. Unfortunately, I don't have a quick fix answer for this one, because as everyone knows probably by now, that pain is complex, no matter where it is in your body. Okay. So just like in the previous questions, I would suggest to check out, check out this webinar, obviously, but also check out a website. It's called tamethebeast.org, tamethebeast.org. It has some really awesome resources for pain related issues. And there's also a really great blog post specific for back pain that I would like for you to read, or anybody to read, about back pain. So it's called Knowledge is Power. I need every person with back pain to know this. And I'll link it. Michael, I'll give you the link.
It's not in the DVD set? It seems familiar. Is that in the video?
In which video? My DIY videos?
Yeah.
No, it's not in there, actually.
But the website is there, no?
The website is there. Tamethebeast.org is there. But this article, this blog post, written by a physiotherapist in the UK, and he's also an educator, is excellent because it debunks some of the myths around back pain and really gives you some helpful hints of what to do. Essentially, it's all around, like, educating you about what's happening in your body and what you can do, and that you're safe to move, and so forth and so on. So knowledge is analgesic, and that has been shown in research and science, that the more you know about why you hurt, the less you'll hurt. And like any persistent pain issue, it takes a collaborative approach with a healthcare professional who's in the know with modern pain science. That's really important. That it's not in everyone's curriculum. They don't teach you this in med school. Okay. So you have to, it's like winning the lottery when you actually find somebody who knows what they're talking about with pain. Honestly, right? It's like winning the lottery.
The internet has helped so much, because if it wasn't for the internet, there's so many doctors who just don't know what's going on.
Well, right. And again, they're well-intended. And I know there's a lot of frustration around failed treatments and money and so forth and so on. And we don't, I believe in my heart that these individuals, all of us who get into healthcare, we don't do it to make money. I mean, I'm not making millions here. No, I don't think they are either. But there are, again.
We're doing this for free, guys, by the way. People are like, this is a free thing that we're doing to try to help everybody. Like, we're doing it from the kindness of our hearts.
Yes.
And so are the doctors too.
Yeah, exactly. And they're trying their best. But again, they have their own limitations. There's a lot of politics around insurance and healthcare in general. And depending on where you live, that is very different. So, everyone's experience is very different. My hope and what I like to think is that everyone has the intention of a good heart and to help people truly. But unfortunately, we do work. Everyone's got their limits, and sometimes they're bound by terrible circumstances that allow them to work a certain way. So just know that. And anyway, going back to this question, sorry, but you know, even though you're hurting now for this person in back pain or any pain, know that you're not alone from it, and that pain isn't permanent. You know, it's not permanent. You can change it and you can get better. So just know that your body is amazing. It can adapt. It has the capability to change in any given moment and to get better. So that is the helpful. That's the most that I can give you for this short amount of time. But yeah, check out those resources because they're very, very helpful. And there's awesome questions to ask your healthcare provider to make sure that they understand modern pain science as well. So there's questions listed right there, and you could just spit them out and ask your provider.
So I have actually a personal question that's been happening. I've never had sleeping problems until I had this, but then that after I figured out the stretching, I was fine. It wasn't until recently I have sleeping problems. I feel I don't know how to explain it. It just doesn't feel right. And it's not in the bladder, but it's around that area. Is that it's like, I would say pelvic bone and then the belly button in between there, that area. It just doesn't feel right. And I think recently I have, what's that called? Like too much gas. What is that called? You hear your stomach always, your digestion making noise. I should have wrote this down, but how do I know where pain is coming from? Because I thought it was the bladder. So recently I've been kind of messing around with the internal trigger point release. And I will say I found a few places that I've been almost every day kind of massaging, and it has helped. Like I really see the difference.
Awesome.
How do I figure stuff out, especially when it's internal?
Right. Okay. So where you asked one interesting question about where is pain coming from? The short answer of that is pain is produced 100% by your brain. It is. So it's coming from a higher level of making the CEO, your brain is making the decision for you to experience pain. But that signal is based on context and also the information being received through the outside. So like your body, all the information, all the input, the stretching, the touching, you know, all of that is, and your systems, like the internal health of your organs and how things are working. All of that information is being processed through the spinal cord up to the brain. Brain makes a decision and then allows certain chemicals to be released or not. It gives an output message essentially, but it is more complex than that. So that's like in a nutshell, it is produced 100% by the brain. Without the brain, there is no pain, which is why you don't have to be so specific when you're treating yourself, like in any given area, because all of the nerves are networking together, branching. So you can work in your tummy, you can work in your back, you can work in your butt, you can work in your thighs, you can work all over as long as it feels good, sending signals up through the body, through your sensors, through the detectors of your body to create a sense of safety. And that message is being talked at the spinal cord level. So there's a lot of changes happening there. And should we send this back up to the big boss or not? And some messages go through and other messages don't go through because, again, it all depends on how much threat there is versus safety. And that is based on the context of any given situation. The biological system, the psychological system, and the sociological cultural system. So all of those things are coming together to create this experience. So when you are treating pain, the best advice is not to just go to the area that hurts, because most likely it's not coming from that area. It's just a sensitivity issue, a global issue. Think bigger. And that's what I would work on. But that's why what you do helps when you're doing like massaging and your diet and everything, because you're calming down those systems. You're feeding the body safe messages to calm things down. And then the brain's like, oh, I don't have to worry about this anymore. Okay, this is good. All right, he's doing something about it. All right, You know what I'm saying?
Yeah.
Yeah, it's definitely complex, but that's the shortest answer I can give.
I'll try to write. I'll try to figure it out more. I thought it was what is that called when you have like not acid indigestion, but something like that. So I've been taking digestive pills just to help me with that, and it has helped. But
Yeah. And when you do hear gurgling like that, like in your tummy, like
yeah,
that's actually normal. Like the book called Gut by Julia Enders, that's in the DIY program that I recommend. But that's like your own gut bacteria, like cleaning up, like, you know.
But mine has been a lot to the point where it's like I'm having a lesson. It's like people are like, "Are you hungry?" I'm like, "I'm not hungry. I don't know what's going on."
Oh, yeah. It's your intestines, like it's motility actually.
Yeah.
Like things working. So I wouldn't be necessarily like super embarrassed about that because it might be because things are working really well. And that might be something different for you that you haven't experienced in a really long time for whatever reason. Or it could be digestive. Maybe it's too much gas production. Maybe you're eating too much fiber, or, you know, like onions and garlic can produce a lot of gas, and, you know, carbohydrates and all of that. So, you know, again, it could be dietary, and you could write yourself a log and see like, okay, if I change one thing in my diet, let's see if it makes a difference. You know, do like an elimination diet.
I think that's the one thing about this that has helped is that you start actually noticing what you do and caring about yourself, because it's so vital to this getting better.
So I have a call. Sorry, I don't mean to like cut everyone short. I didn't know this was gonna be. I have a
no. It's actually way longer. We're gonna have to go because it's 12:30 at night in the morning. I mean, in Japan. So I'm gonna cut it off. I need to go to bed. I'll send you an email. Okay.
Thank you. Yeah, and then I'll send you the email with the link so you can link it to the YouTube video for everyone.
Yes. So thank you, Dr. Susie. This took way more than I thought. It's more fun. I hope we can get more people. If you have any questions, put them down in the comment section. Hopefully, Dr. Susie has more time next month, and we'll have 10 more.
Cool.
Thank you.
Awesome. Bye.
See you guys.